Okay, with that being said, this is your 2015 open enrollment meeting for your employee benefits. My name is Guillermo Gonzalez. I work for Arroyo Insurance Services. We're your employee benefits insurance brokers, and I'm going to be going through the comprehensive employee benefits program that we've decided to renew your group with this year. Okay. So first off, I know that Chris was in the meetings to make this announcement, but your benefits program is actually getting a few changes. One of the changes is going to be that the Kaiser Permanente HMO plan is now going to be the base plan. Okay. Again, Kaiser is now the base plan. So every other plan is going to be a buy-up option. So we decided to do this because about half of the employee population went to Kaiser last year and they had to do it at a buy-up cost. This year, it won't cost you anything other than the $25 employee contribution that you do every paycheck. So everyone's going to have the Kaiser plan as the base plan. Every plan other than that is a buy-up option. Another change that's going to happen is going to be that the dependent premium, and this is for dependents that are under 19 years old, okay? For your children, Made Goods is going to pay 75% of that dependent premium now. That went up from 50% last year. Okay, so last year you had 50% for spouse, 50% for dependent. Now you have 50% employer-sponsored of spouse premium and 75% employer-sponsored dependent under 19 premium, okay? So with that being said, your benefits program is already a very comprehensive one. These few changes in the contribution just makes it even more rich. It makes it even more of a value, and it adds to your compensation each year. Most companies are actually scaling back insurance programs, especially employee benefits, and they're passing on more cost sharing to the employees. Well, your employer is doing it a little bit differently. They're actually kind of beefing up the employee benefits program. So that's just something that we don't see often. So you're lucky to work for Made Goods. So a few things. Employee benefits is not getting any cheaper. It's not getting any less expensive. It's actually getting more expensive. And this is due to the cost of delivering medical services. That increases about 5 to 10% every year. And this is due to new prescription drugs, diagnostic technologies, increased life expectancies. You know, we're living a lot longer, but it's also costing us a lot more money to kind of keep us alive longer. The cost of labor, hospitals, medical centers, doctors, nurses, they all want to get paid well. And the utilization of our medical benefits, the way we consume care. And I'm going to be touching on that a little bit later. Another thing that goes into it, though, is the Affordable Care Act has taxes and fees, federal compliance requirements that adds another 6 to 8% to premiums. So here we go. Here's what's staying the same. We're able to continue a very high level of benefits, okay? So all full-time employees, all full-time benefits eligible employees may select medical dental plans, sharing the monthly premium with your employer at $25 per payroll deduction, okay? That remains the same deduction that you would have last year. All insurance carriers are going to be the same. All the plans that were offered last year are going to be offered this year, okay? So CalChoice remains your private exchange provider. They have Kaiser, Aetna, HealthNet, and Anthem Blue Cross plans. Assurant Employee Benefits remains your dental, group life, death and dismemberment, long-term disability, and voluntary life provider. VSP is still going to be your vision provider, and that rate is the same going through September 1st, 2016. But if you do need to make any changes on that, please let us know. All right, here's what's changing. There's plan modifications that are effective September 1st. As I mentioned, Kaiser Permanente will now be your base plan. All other plans are going to be buy-up options. Ardmore will cover dependents under the age of 19 at 75%, and dependents 19 and older, this includes spouses, at 50%. We're also going to be introducing an online benefits enrollment and administration system called Maxwell Health, and we're going to give you some instructions on how to log on and enroll into the benefits administration system. This system eliminates the need for paperwork and filling out tons of applications to make sure that you get your benefits. You're actually going to be doing it more like an Amazon shopping experience, online shopping experience. That's what we hope for. So this is what we're going to need from you. August is your open enrollment period, and now is the time to make any changes, okay? So if you need to add or remove dependents, if you need to change plans, if you're not on the plan right now and you've satisfied your waiting period, this is the time to do all those things, okay? So because of the online enrollment that we're going to do this year, you actually have from the 13th, that's this Thursday, until the 21st to make any changes online, okay? So after the 21st, the online enrollment window closes. We need you to make all your changes before the 21st on the link that we will provide in an email, okay? Here's what we're going to need from you that, like I said, no more paper enrollments. To make a change, you're going to have to log on to Maxwell Health and make your enrollment changes online. And even if you don't want to make a change, we recommend that everyone just follow the easy to use directions, log on to Maxwell Health and verify that you are on the correct plans. We've actually preloaded your information and your plan information into the Maxwell Health portal, and all you have to do is verify the information, okay? All right, so we're going to be emailing you these in a PDF format, but this is the type of easy to use directions that we're going to send you. You're going to log in, you have a welcome message, you review and confirm your info. If you're a new hire, you enter your information. If you are on the insurance already, then you just review and confirm your information. If you want to add any dependents, you confirm and enter in dependent information on the next page. And then you just go to shop the carrier that you want, and then you select the coverage that you want for each product, medical, dental, vision, disability, voluntary life. Then you review your premiums, and similarly to Amazon and eBay, it's just kind of like an online checkout. You just see that your payroll deduction is going to be exactly what you want it to be, and you confirm it. It's that easy, okay? So your medical plan provider is still CalChoice. Kaiser Permanente Gold HMO-B is the base plan. Aetna Gold HMO-B is now a buy-up option. The HealthNet Gold HMO-A, HealthNet Gold PPO-A, Anthem Blue Cross Gold PPO-A are all available to every employee as a buy-up option. However, the Anthem Blue Cross Gold PPO-D is only available to out-of-state employees. And this is because this PPO has a strong network on the East Coast and nationwide, so it's available if you're out of state. Assurant provides dental, group life, accidental death and dismemberment, voluntary life, accidental death and dismemberment, and long-term disability. VSP will provide your vision coverage. Okay, so here we go. We're going to go ahead and review the medical insurance first and go to dental and vision after that. Term life, voluntary life, and long-term disability will round out the coverages. So as you can see, we have put the plans side to side so that you have your base plan all the way to the left, okay? You have your base plan all the way to the left. That's your Kaiser Gold HMO-B. Then to the right of that, you have your Aetna Gold HMO-B. That's this one right here, right in the middle. And then to the right of that, you have the HealthNet Gold HMO-A. These two plans right here, the Aetna and the HealthNet, are for if you want a private practice HMO plan. You don't have to go to Kaiser. You go to a private practice physician and you stick to an HMO model. These plans are available for you, okay? They're available for you at a buy-up cost, okay? Kaiser is going to be the base plan. So as you can see, There are no individual deductibles or family deductibles. The individual out-of-pocket is set at $6,250. The family out-of-pocket is set at $12,500. Okay, these numbers represent the most that you would spend in a calendar year. Okay, primary care physician office visits are at $30 copay per visit. Specialist office visits are at $50 copay per visit. A specialist office visit is anyone who doesn't practice internal medicine or just general medicine. That's going to be your specialist, okay? As you can see, preventative care visits are at no charge. So everyone should be getting a physical at least once a year, and this doesn't cost you anything. For women, you actually have a physical and a well woman exam, okay, all free of charge. Pediatric dental and vision is included in every plan, but this is not comprehensive coverage. This is more for screenings for your kids. So your kid could get a dental screening. They can get a vision screening, but if they actually need any treatments, they're going to have to be enrolled into the group dental and group vision plan. Like if you need frames or lenses or things like that, they're going to have to be enrolled into the group plan, okay? Lab and x-ray procedures. It's a $30 copay for a lab, and an x-ray procedure is a $50 copay. MRI and high-tech imaging services are $250 copay per procedure. Okay, for hospital services, if you are hospitalized on the Kaiser plan, it's a $600 copay per day up to a 5-day max. And that means after 5 days, the 6th day, you wouldn't pay it. Outpatient surgery in a hospital is a $600 copay per procedure. Emergency room is a $250 copay per visit, okay? But I want you to see the difference between a $250 copay for an emergency room and an urgent care visit at just $30 copay. The urgent care will be able to treat you as well as the emergency room can. We usually say that it's emergency room is for severe, if you're bleeding out, if you can't breathe, then please, that's what the emergency room is there for. But if you just you know, have a flu or you have some pain that you need treated, an urgent care center can treat you just as well, and you're going to be waiting a lot less if it's not severe, okay? For ambulance on the Kaiser, $250 copay per transport, okay? Very important on the Kaiser plan, it does not have an annual prescription deductible. The other two plans do. And I'm going to go ahead and and tell you what that means in a second once I get to the other plans. For Tier 1 generic, 30-day supply is a $15 copay. For Tier 2 brand name medication, a $30-day supply is a $50 copay. For non-formulary Tier 3 medication, it's a $50 copay and prior authorization is required. For Tier 4 specialty drugs, a 20% coinsurance up to a $200 max. So what that means is that if a medicine costs $100 and you have a 20% coinsurance, you would pay $20. Now, if it costs $1,000 for that medication, you would pay $200, and that's your max. That's the most that you would pay for medication in this plan. There is a mail order 90-day supply benefit built into all plans. So what that means is that you pay 2 months of copay, and you get the 3rd month for free. And it all gets delivered to your home. So if you have a chronic condition that you take prescription medication for on a regular basis, we really recommend this plan. It's a $30 copay for a 90-day supply of generic medication, a $100 copay for a 90-day supply of brand name medication, and another $100 copay for a 90-day supply of non-formulary Tier 3 medication. Okay, so that's the Kaiser plan. The Aetna plan has no deductible for the individual and family. Individual out-of-pocket maximum is set at $5,500. The family out-of-pocket maximum is set at $11,000. Okay, there's a $30 copay for a primary care physician office visit and a $60 copay for specialist office visit. Again, this is on the Aetna. We're covering the Aetna plan now. the second plan. This is offered at a buy-up option. As I said, there's no charge for preventative care services. Physical and well woman exams are included. Pediatric dental and vision is included, but it's not comprehensive coverage. It's only for screenings for your kids. For lab and x-ray procedures, there is a $30 copay per procedure. For an MRI and high-tech services, there is a $250 copay per procedure. And for inpatient hospital services, there is a $500 copay per day up to a 5-day max. So after that 5th day, you wouldn't pay anymore. Outpatient surgery is going to be a $600 copay per procedure. Emergency room visit is $250 copay per visit, as opposed to the urgent care center, which is a $50 copay per visit. Ambulance is a $150 copay per transport. Now here's where I think the decision to go to a Kaiser or to consider staying on an Aetna or HealthNet plan really lies. There's a $250 copay, $250 deductible that applies to brand name and non-formulary medication, okay? So what that means is that if you get prescribed something on either of these two plans and they are brand name medications, you can request a generic substitute. Sometimes, very rarely, there is no generic substitute for your medication, so you would need to pay the $250 deductible before you can access the copays, okay? So for Tier 1 generic medication, you only pay $10 copay on the Aetna. But if you get prescribed something that's brand name, you would need to pay the $250 deductible. After that, you would pay the $50. That's a one-time deductible. So once you've met that, you don't have to pay that for the rest of the calendar year. For the Tier 2, you would pay $50 copay for a brand name medication. For Tier 3, this also applies to the $250 deductible. After the deductible, you'd pay a $100 copay. For Tier 4 specialty medication, you'd pay a 30% coinsurance up to a $500 max. So that means that the $500 is the most that you would pay in this plan for a medication. And then the mail order is available. So if you have questions on the mail order, you can contact Celia, and Celia will contact us regarding getting you set up with the mail order. There is a form that you need to fill out, so we like assisting you with that. So now I'm going to go over the HealthNet Gold HMO. As you can see, there's no individual or family deductible. The individual out-of-pocket maximum is set at $4,500. The family out-of-pocket maximum is set at $9,000. Primary care office visits are $40 copay per visit. Specialist office visits are a $50 copay per visit. Preventative care visits, as always, are not going to be charged. Pediatric dental and vision is included, but it's not comprehensive coverage. Lab and x-ray procedures, $25 copay per procedure. MRI and high-tech services are $100 copay per procedure on this plan. So the HealthNet HMO plan has lower copays when it comes to the testings. Inpatient hospital service is also lower. It's a $500 copay per day. And then it's a 4-day max instead of a 5-day max. Outpatient surgery is only $500 copay per procedure, as opposed to $600 on the other plans. And an emergency room visit is $250 copay per visit. The urgent care visit is still a $40 copay per visit. Ambulance is going to be a $200 copay per transport. And then we get to the prescription drugs. There is a $200 deductible on this one instead of the $250 deductible. But for Tier 1 medication, that's a $20 copay. For Tier 2 brand name medication, that is a $30 copay. For Tier 3 non-formulary medication, that's a $50 copay after the deductible has been paid. For Tier 4 specialty medication, there's a 30% coinsurance with no max. So on this plan, you wouldn't know how much you would, if a medication costs $2,000, you'd end up paying $600 for specialty medication. And there is also a mail order benefit built in. Okay. So these are your HMO options for the coming plan year. They're the same ones as last year. So nothing really is changing there. The only thing that's changing is that the Kaiser HMO plan will be the base plan. Here are your PPO options for the coming year. They're the same ones as last year. There's a HealthNet Gold PPO. There's an Anthem Gold PPO A, and this one's available to everybody. And then there's an Anthem Gold PPO D, which is only available to out-of-state employees, okay? So the HealthNet Gold PPO is actually a really popular one right now because it doesn't have a deductible. Most PPOs have about $500 or $1,000 deductibles. This one doesn't have a deductible, so you won't have to pay first dollar out of pocket before you can access the benefits. Another reason why it's popular is because the copays are set so low that they very closely reflect HMO copays. So as I mentioned, no individual deductible on the HealthNet Gold PPO, no family deductible. The individual out-of-pocket maximum is set at $6,250. The family out-of-pocket maximum is set at $12,500. Office visits are going to be $30 copay for internal medicine doctors. Specialist office visits are going to be a $50 copay. Preventative care, there is no charge. Pediatric dental and vision is included, not comprehensive coverage. X-ray and lab procedures, $30 copay for lab. X-ray is going to be a $50 copay. MRI and high-tech services is set at a 20% coinsurance per procedure. So if that MRI ran you at like $1,000, you would pay $200. Inpatient hospital services, this is where it could get pricey. 20% coinsurance per admission, okay? It's not per day, but it's per admission. So that means that when you're admitted to the hospital, that cost is what you would pay a 20% coinsurance on. So it's a little less than if it would be like per day, 20% per day. That would be a little bit more expensive. For outpatient surgery in a hospital, there's 20% coinsurance per procedure. For emergency room visits, there's a $250 copay per visit. Urgent care visit is going to be a $60 copay per visit, and an ambulance visit is going to be a $250 copay per transport, okay? There's no prescription drug deductible on this plan. There's, for tier 1 generic medication, $15 copay. For tier 2 brand name medications, a $50 copay. And for tier 3, there's a $70 copay. For specialty drugs, there's a 20% coinsurance with no max. So again, if a drug costs $2,000, you end up paying $600 of that. Mail order 90-day supply is available on all plans. So please let us know if you need any help getting signed up on that. Okay, so that's the HealthNet Gold PPO-A. For the Anthem Gold PPO-A, there is a $500 deductible. It's set at $1,000 for family deductible. Individual out-of-pocket maximum is going to be $3,500. The family out-of-pocket maximum is going to be a $7,000. Primary care office visits are a $25 copay for the first 3 visits, and then after 3 visits, the spreadsheet got reformatted somehow in the PowerPoint, but I actually know these benefits by memory. So it's a $25 copay for the first 3 visits. After 3 visits, it's going to be a 20% coinsurance. Most office visits are set at about $100 to $150, so expect to pay about $20 to $30 per visit after the first 3 visits. Specialist office visits, again, $25 copay for the first 3 visits. After 3 visits, 20% coinsurance, okay? No charge for the preventative care visits. Pediatric dental and vision is included, not comprehensive coverage. Lab and x-ray procedures are 20% coinsurance after deductible, and so are the MRI and high-tech services. So you have to pay your deductible first, then you would pay 20% coinsurance. Inpatient services, and I apologize that it got cut off here, but it's a $500 copay plus the 20% coinsurance, okay? Outpatient surgery is same. It's a $250 copay plus 20% coinsurance. For emergency room visits, it's a 20% coinsurance after deductible. Urgent care center visits, also a 20% coinsurance after deductible. The ambulance would be a 20% coinsurance after deductible as well. There's no prescription drug deductible. Tier 1 generic 30-day supply is going to be $15 copay. For brand name medications, a $35 copay. And for Tier 3 non-formulary medication, there's a $70 copay. For Tier 4 specialty drugs, 30% coinsurance up to a $500 max. So $500 is the most that you would pay for a medication 30-day supply on this. And the mail order 90-day supply is available. For our out-of-state employees, this is the PPO that we would strongly recommend for you. The Anthem PPO Gold D, the Gold PPO D, Anthem Gold PPO D. There is an individual deductible of $1,200 on here, $2,400 for your family. The out-of-pocket maximum is set very low at $3,500 and $7,000 for your family. Office visits are only at $20 copay. There's no deductible to be applied there. It's waived. Specialist visits are a $40 copay. The deductible is waived. Preventative care visits are at no charge. Pediatric dental and vision are included, but not comprehensive coverage. Lab, x-ray procedures, MRI, and high-tech services are all at 20% coinsurance after deductible. Inpatient hospital services, if you're to be hospitalized on this plan, you'd pay 20% coinsurance after deductible. Outpatient surgery in a hospital is 20% coinsurance after deductible. Emergency room visit would be a $200 copay and then 20% coinsurance after deductible. Urgent care visit would be a $40 copay and the deductible is waived on that. You don't have to pay a deductible for that. Ambulance ride would be a 20% coinsurance after deductible. There is an annual prescription deductible on this plan, so you would pay $250 out of your pocket before you can access the brand name medication and the Tier 3 non-formulary and even the specialty drugs. You'd have to pay $250 out of pocket. But if you want to request a generic substitute, Tier 1 generic medication would be a $15 copay for 30-day supply. For Tier 2 brand name medication, there's a 30-day supply for $35 copay. Tier 3 non-formulary, there is a $70 copay. And the specialty drugs on this one is a 30% coinsurance after the deductible has been met. Mail order is available for all plans, so please let us know if you need that form, need to be enlisted in that. Is there any questions on the medical benefits so far? Okay, I'm going to continue going. How to find a provider. You log on to CalChoice, you click provider search, you put your plan year effective date, and then you put the plan that you're on, and you find a provider close to home. On the PPO option, you can go to any doctor you want because even if that doctor isn't in the network, there is an out-of-network reimbursement that you get. On the HMOs, you have to stick in the network or else you won't get reimbursed for your costs, okay? Other than an emergency situation. Okay, I'm gonna go on to the dental insurance. So for the dental insurance, this really goes with a supplemental document. It's called the fee schedule, the HMO fee schedule, which we're gonna be emailing to you so that you have it for your records. But basically, you have two options for the dental coverage this year. It's the same ones as last year. You have a DHMO with set copays that are listed on this fee schedule. And then you have the PPO where you have co-insurances and then you have an annual benefit maximum, okay? I'm going to go through both plans. The PPO is set at a buy-up option. The DHMO is your base plan. There's no individual deductible or family deductibles on the DHMO, but on the PPO, it's $50 for individual deductible, $150 for a family deductible. Annual benefit maximum, there is none on the DHMO, it's unlimited, but on the PPO, it's a $1,500 per insured person benefit maximum. No coverage waiting periods on either plan, so you can get anything from fillings to root canals as soon as you get on the plan. Out-of-network reimbursement, very big. DHMO does not have any, but on the PPO, you get 90th percentile of usual and customary, which means you get 90% paid by the insurance carrier of whatever dentists in that area are charging. So if dentists in that area are charging $900 for a root canal, you would get paid 90% of that, okay? As you can see, preventative and diagnostic care coverages, they're 100% no copay, 100% no deductible is applied to that on either plan. So you get one cleaning each 6 months, okay? So it's 2 cleanings per year. They have to be separated by 6 months, but we recommend that everyone do this because it just prevents the larger claims down the line, okay? Preventative and diagnostic care benefits include oral evaluations, the routine cleanings, fluoride treatments, sealings, x-rays, and panoramic film, okay? Basic care coverage, as you can see, we're going to provide you the fee schedule for the DHMO network, but it's 80% covered after deductible on the PPO, okay? So that means if you have a $200 filling or a couple of fillings, you would end up paying $40, and the insurance company would cover the rest. Basic care benefits include more advanced x-rays, fillings, extractions, biopsies, periodontics, and endodontics, which are root canals. Major care coverage, you would pay 50% after the deductible on the PPO, and then on the DHMO, you would have set copays that you can see exactly what you would need in terms of a treatment, and then it will have a listed copay there. On the PPO, you have 50% deductible after deductible. So you pay half and the insurance company pays half. And these major care benefits include crowns, dentures, fixed bridges, space maintainers, general anesthesia, and sedation. Very important, orthodontia benefit. On the PPO option, it's not available, but on the DHMO, for children, you have a maximum lifetime benefit of $1,695, and this is up to age 19. For adults, you have a maximum lifetime benefit of $1,895. So if either you or your kids are interested in getting braces, I would recommend the DHMO option, as it will be covered there, but on the PPO, you have none. Orthodontia eligibility is adult and children, okay? There's also a LASIK surgery that's available. I'm sorry, that's on vision. I'm getting mixed up with these. All right, so these are your dental benefits. As I said, you will be emailed the DHMO fee schedule, and then please let us know if you have any questions on that. How to find a provider. You click on, you go to assureemployeebenefits.com, click on find a dentist, you put your group number in, which is 546-4092, and whether you have the DHMO or PPO plan, you elect either plan, put in your zip code, and it's going to give you a list of providers close to your home. For vision insurance, you have, I'm sorry, I just got a message from, okay. Can everybody can still hear me?
Yes.
Okay, perfect, thank you so much. Okay, so for vision insurance, it's the same plan as last year. You have exams at $20 copay every 12 months. You get $130 allowance for any frames you want, but if it's a preferred brand, you get $150 allowance, which means that you pretty much get like $150 bank for preferred brands, and you get $130 bank for any frames that you want from a in-network provider. Anything after the $150 or $130, 20% savings in the amount over the allowance means that if you pick something that's $200, you would get $130 taken care of by the insurance company. The $70 left over would be deducted at 20%, so you'd end up getting another $14 off there, and then you'd end up paying the remaining $56. For lenses, these are single, bifocal, and trifocal lenses. You can get them every 12 months, okay? But for frames, you can get them every 24 months. So if you got frames this year, you'd have to wait until 2 years from now until you can get new frames. You can get the lenses replaced in the frames, but you can't get new frames themselves. And then there's also the progressive lenses and those kinds of advanced frames, and you'll have kind of like a list of how much that will cost. But if you go to an in-network optometrist, they're going to be able to give you a quote on how much each frame would cost, and just make sure that it's going to be within kind of the cost that you were already sent. Like the information for the VSP plan will be sent to you. Just make sure that you're reviewing the costs and making sure that everything looks okay there. There is LASIK surgery available at a discounted rate, but you have to contact a surgery center that is contracted with VSP. And then what we recommend is that you just run quotes. You see how many, you see like 2 or 3 surgery centers and see how much they would charge you, and just go with the best quote. It's kind of like an auto mechanic quote. So there's also benefits for contact lenses. Instead of glasses, you also get a $130 allowance for that, and that you can get every 12 months. Okay. All right, so how to find a VSP provider. You go onto VSP website, you find a VSP doctor, and you put in your zip code. It's as easy as that, and there should be a lot. VSP is actually the largest provider of vision insurance. There should be a lot of providers near you. Okay, so group life, accidental death and dismemberment, and long-term disability coverage. Made Goods purchases $50,000 of life insurance for every full-time benefits eligible employee. There's also a rider that comes with that policy that's called an accidental death and dismemberment rider. So what this means is that if you were to die in a car accident, your family would receive double the $50,000 original limit. So you'd get $50,000 from the life insurance, and the accidental death and dismemberment would pay you another $50,000. These are some benefits that you hope you don't use, but they're there to protect your family just in case something were to happen. Long-term disability insurance benefits. So you get, if you're disabled for more than 90 days, you have a plan that will pay you out 60% of your pre-disability pay. The benefit maximum is going to be $6,000. And then the benefit begins 90 days after disability. So I'm not sure how it is in other states, but in the state of California, if you're to be disabled today, in 2 weeks, you're actually qualified to receive state-sponsored disability. That disability, it's called short-term disability. It stops after 90 days, but if you're still disabled, the benefits from the long-term disability plan kick in after 90 days, okay? So again, this is a benefit that you hope you don't use, but it's there to protect your family. You have voluntary life and accidental death and dismemberment limits. So if you wanted to purchase life insurance on top of the $50,000 life insurance that Ardmore Made Goods has already purchased for you, you can, but it's going to come out of your paycheck. And it's actually less expensive to purchase it this way than it is to purchase it in the individual market. So an employee can elect up to 5 times their salaries in increments of $10,000, but you can't go over $500,000. Spouse, you get up to 50% of whatever your coverage is. So an employee's coverage is $100,000. The spouse's coverage can be $50,000, and you get it in increments of $5,000. Not to exceed $250,000. For a child, you can get $1,000, $5,000, or $10,000. Okay. Guaranteed issue amounts are $10,000 for the employee, $25,000 for the spouse, and for the child, it's another $10,000. Okay. Are there any questions here? Guaranteed issue. I should actually review that with you all. It's the amount of insurance you can get before the insurance company starts asking you any kind of health questions. So that's the guaranteed issue amount. And that concludes our open enrollment meeting. I'm going to be sending Celia some documents to forward out to you for your reference. The dental fee schedule. You'll have a copy of the open enrollment benefit summary that we handed out to everybody in person. And you're going to have the Maxwell Health instruction so that you can go and log on starting Thursday, August 13th to make any changes, okay? Again, the open enrollment window for the online enrollment stops on the 21st, okay? So you have more than a week to do your changes, but on the 21st is the last day you can process any changes, okay? We're also going to be sending you an email inviting you to the portal, Maxwell Health, and inviting you to make any changes you need on your enrollment, okay? So with that being said, I don't have anything else that I need to cover. Celia, did you want to go over anything? Okay. Is everybody still logged on?
Yes.
Excellent. Okay, so with that, I'm going to go ahead and close out the meeting. You're also going to receive an MP4 of the meeting so that you can log on whenever you want and take a look at it, okay? Thank you, everybody, for your time.
Thank you.
Thank you.
All righty. Bye-bye.
Bye.
Bye-bye.